And then
Yes.
you
True.
were kind of flirting with cardiology, and like 3 months later, you went to Genova and chose surgery for your studies. So, were you also
Yes.
considering surgery, or was there a different motive for that?
Well, basically, I was obligated to do surgery there because it was my rotation here in Brazil. So I'm not that into surgery. I was in the very beginning of college, but I think it is kind of like a general thing because medical students, when they see surgery, when they look at, ORs and surgical gowns and scalpels and things like that, that is exciting. So it looked exciting, from outside. And then when I started to really live the routine and see and talk to surgeons, I started seeing that that's not the kind of life that I want to have. But I do enjoy surgery a lot. I enjoyed watching surgeries in Italy. I enjoyed scrubbing in surgeries here in Brazil. I really enjoy the concept of surgery. I think it's very, it solves the problem, right? So it's very, immediately the problem is solved. It's not like giving a medication and waiting for it to take action. It's basically something that the problem is solved with the surgery. And I think that there are very nice aspects and beautiful aspects about surgery, but I'm not interested in having it as a specialty. But in Genoa's case, it was basically because I needed to do a surgical rotation for my hours back here. In this case, my university did not accept me going and having the clerkship be related to any other area other than the one that I was supposed to have here in Brazil. So basically, I needed to choose surgery because of that. But it was super fun. It was super fun. Surgery is fun. That's the thing about surgery. It's fun, it's visual, it solves the problem. But do I want to work with surgery? Not so much. That's one thing that even though I'm very indecisive about the specialty, about all of those things, one thing I'm sure of is that I don't want to do a surgical specialty.
Much of what you've just said is barely even an opinion, it's almost common knowledge. I couldn't agree more with a lot of it. Because, yes, surgery is exciting. One of the things a new med student likes the most is going into a surgery and watching it. And it is a different experience. It's not something you see on the street. So you see someone open, you put your hand inside of someone, and you come and you
Yeah.
tell your grandparents, hey, I watched a surgery today. I touched a lung.
Yeah.
and,
Yeah.
and
Yeah.
it is the kind of thing very few non-medical people can claim. How many people can say they've touched a lung, for example, from a living person?
Exactly.
So if it's something exciting indeed, and I quite like surgery, uh, and I think one of a professor once said is that, quote, the beauty of surgery is that you take out the disease with your hands, end quote. And surgery
Interesting.
is very pragmatic. That's probably the most appealing thing about surgery. You have a surgical patient, you go into surgery, and often the patient improves or dies and the problem is
Yeah.
solved. And of course, that's an oversimplification. If you go, for example, into transplant surgery, of course, to a large degree, you're creating a problem as well, because now the patient is going to have to be on immunosuppression and everything else. But as a whole, surgery is very resolutive, is very pragmatic. And
Yeah.
I,
That's
I,
true.
I almost lost my original point. Where I was going with this commentary? Oh, I remembered it. But one of the things you mentioned, and I couldn't agree more with that, is that interest in an area is different from appreciating the lifestyle. These are very different things. Sometimes we absolutely love the theory, the working of something. You just find it beautiful and interesting, but actually going there and being there and working the hours is an entirely different experience. Because even as med students, you rarely go, for example, into surgeries every day. You don't scrub every day. That would actually be a major accomplishment. Usually people battle to see who will scrub and go into the surgery. So if you are quite successful, you actually go inside one surgery every 2 3 days, and that would be a great rate of success, at least on my personal experience. So you don't actually get the feeling of what it's like, for example, to leave the hospital at 10 p.m. every day. That's the sort of thing you have to consider. That's not very very much experience during med school.
Yeah. Yeah, that's also one of the reasons that I want to work for a year and a half, to know, to get the feeling of going to work every day at a hospital, or going to work every day at, primary care clinic. Here in Brazil, we call UBS, right? Basic health unit, I could call it here if I could translate it. But it's a lot different. The contexts are so different. And I want to have some experience in different types of services, because I want to get to know myself before I make a decision about going to residency. Surgery, it's good that I have basically discarded it, because it is a big, there are a lot of surgical specialties. So I think a big chunk of things have been deleted from my mind. So now I just have to focus on the clinical areas. And then even inside the clinical areas, I need to choose. So now I need to have a little bit of more experiences inside those areas and then decide. But what you said is, I couldn't agree more. Also, it is so different. So different. Admiring and thinking something is fun from actually living those days and those experiences inside of that area. I think it's two different worlds. And people are not so much aware of this. I think people are so excited about the interesting aspect of a specialty, and they forget to basically weigh
The cons.
the living aspect of that thing. So they are more focused on the interesting part, but how about the living part? They're not so focused on that. And then they make decisions. They make decisions about their specialties, and then when they start living their specialties, they're like, this is not what I was, picturing. This is not what I imagined, because probably the person only focused on the interesting part, on the, oh, I think this area is so nice. But they were not focused on, do I want to actually live and work with this for the rest of my life? Maybe not so much. So right now I'm very aware of this, and I'm trying to make my decision as aware of this as possible. I'm trying to be wise with this, because it's a big decision.